Hello, I'm Dr. Michael Raff, and I'm going to talk to you today about Morquio syndrome type A. Morquio syndrome type A, sometimes just called Morquio A, has other names as well. It's sometimes called MPS IV A or mucopolysaccharidosis type 4A, but for short, we'll call it Morquio A. Morquio A is an inherited condition, which means that both parents of the individual who has Morquio A has the condition genetically as a carrier to pass it on, and we'll talk more about that. People with Morquio A are born with Morquio A. They cannot break down glycosaminoglycan, or GAG for short, because their bodies don't make enough of a particular enzyme, and that enzyme is called N-acetylgalactosamine 6. Now, if you don't have 4 years of medical school like I do, you can call it GALNS. Now, this enzyme breaks down or recycles materials in the body that aren't of use any further. When the body doesn't have enough of that enzyme, these GAG molecules build up in tissue, in bones, in the major organs of the body. Now, when these GAG molecules build up, this can cause some serious problems. Heart disease, bone problems, vision problems, hearing loss, breathing problems, and sometimes it can shorten your life. So let's talk more about Morquio A in detail. We talked about a missing enzyme. Let's talk about that a little further. In Morquio A, that specific enzyme that we talked about, that I'll let you pronounce, is deficient. What happens is that a molecule called keratan sulfate and another molecule called chondroitin 6 sulfate build up. That's what doesn't get broken down in Morquio type A. And these keep building up and building up until you get organ problems that we will now talk about. So, multiple organ systems. On the left are some of the skeletal findings, because those are the most obvious and most common in Morquio type A. However, as you see on the right, other organs are affected, and we will talk about both. Despite these things that Morquio A does do, one thing that it does not do is affect the brain. These individuals can think and learn just like anyone who does not have Morquio A. So let's look at the progression of Morquio A. Morquio A, as a progressive disorder, means that babies born with it will probably manifest nothing to suggest they have Morquio A. But over the years, as they grow and mature, features of Morquio A and the problems associated with it will start to emerge. Let's talk about the signs and symptoms of Morquio A and what can be done to manage them. Morquio A affects the eyes, and I think the picture here makes that very clear with that nice blow up of the eye. There can be corneal clouding, meaning the front part of the eye is harder to see through. There can be blurring due to astigmatism, something common in the population. Nearsightedness, called myopia, is common. Farsightedness, sort of the opposite, can be seen as well. And then finally, cataracts are often seen at an age younger than when they typically emerge in the general population. Visits to an ophthalmologist, a doctor of the eyes, is strongly recommended, and the ophthalmologist, along with your primary doctor, can follow closely to make sure you are optimizing your eye care and optimizing your vision. Hearing loss is common in Morquio A. Often it's due to frequent sinus and ear infections, so it is very important to treat these aggressively. Antibiotic treatment, when given promptly, can take care of these the vast majority of the time. Doing so reduces the chance of having significant hearing loss. If hearing loss does exist, is documented, hearing aids may help with this. Individuals with Morquio A often will have issues with their teeth as well. The teeth may be wide, they may be uneven, and the coating of enamel on the tooth might be very thin, which predisposes them to cavities. Some of the teeth may be sharp or have unusual shapes. Going to a dentist regularly, as we tell everyone, is very important, but more so with Morquio syndrome A. Infections in the mouth can cause problems in the rest of the body, so all the more reason to have dental care taken care of promptly and appropriately. The heart is also affected in Morquio A. Individuals with Morquio A often have thickening of the heart valves. Such thickening can lead to regurgitation, where you get backflow of blood through the valve. You can also have some narrowing, where you have an impediment to the forward flow of the blood. In Morquio A, the heart itself may become abnormally enlarged. You may have an abnormally rapid heartbeat. You may have chest pains. Individuals with Morquio A will often experience anxiety as a result of heart trouble. Fortunately, we have good ways to track this, and we have good medical and surgical treatments such that with appropriate care, much of these problems can be prevented or reduced. The lungs and the airways that lead to the lungs are also affected. Problems that individuals with Morquio A might experience can include respiratory failure, the most extreme of examples, sinus problems, including infections and inflammation, respiratory infections such as bronchitis and pneumonia, noisy breathing, including snoring, even sleep apnea, where you, while you sleep, briefly stop breathing and then often awake partly with a start, and that very much interrupts sleep. Individuals with Morquio A will often also have large tonsils and large adenoids. If you have any of these symptoms, you see your doctor. You can get referred to a pulmonologist, a lung specialist, or an ENT doctor, and medical treatment and surgical treatment is available if necessary. The bones and the spine in Morquio A are quite significantly affected. Examples include something called odontoid hypoplasia. What this means is the very top of the spine below the skull can be underdeveloped, which can lead to concerns about the stability in the neck. Along with that, there can be weakness of the neck, as well as compression, squeezing of the spinal cord. Knock knees, so the knees come in together, often quite significantly in Morquio A, such that it really interferes with walking, and often surgery is necessary for that. Flexible joints. If a joint is too flexible, it's hard to hold it stiff when you need to stay in place or when you need to support weight. That is a problem as well. There can be arthritis, scoliosis, curvature of the spine, and limitations in the movement at the hips and at the knees that cause you to have a gait, walking, that looks somewhat abnormal. Fortunately, orthopedic surgeons are very good at dealing with many of these problems, and an orthopedic surgeon is typically part of the care team involved in Morquio A patient care. Speaking of surgery, individuals with Morquio A will often need surgery for the bones, for the airways, or what have you. These surgeries should be performed by specialists who have some experience with Morquio A or at least with one of the other lysosomal storage disorders, and such surgeons do exist. Surgery will often be for the heart, the lungs, and the ENT tract. I will also mention that we often will use specific anesthesiologists who, like the surgeon, have experience with either Morquio A or one of the lysosomal storage diseases. These anesthesiologists have extra experience in treating the sometimes difficult airway of patients with Morquio A. That concludes our discussion of Morquio type A. I'm sure you'll agree that there are lots of medical issues, lots of things you need to do with your doctor and other healthcare providers, but I think you'll agree that there are effective treatments, very effective treatments, I can assure you, and that we can ensure that anyone with Morquio A is able to enjoy life fully. Thank you for your attention.